to be more clear in how you can sequence aspects of it so that you can be more efficient and faster in moving the patient along and getting into the habit of knowing what comes next. And rarely, even for me, it has been time for speeding up the assessment, speeding up the treatment, and moving quickly to the chain tests, which I find absolutely valuable. I'm so happy that
You
we
know,
do
you
that.
say that, and it's like I'm thinking about what I'm doing, and for better or worse, it's hard for me to even get to the chain tests because at least my patients, they consistently are failing the primary screens.
Mm-hmm.
Unfortunately, whether it's me or them or just a combination of everything, it's uh, they fail the spinal screens, the pelvic screens all the time. So it's
That's
hard to kind of move people on to the
mm-hmm.
to the chain tests and things like that. I mean, of course, I do eventually and use them, but the idea of, okay, well, we're gonna screen through, we're gonna get this much more efficient, quicker, and move on to the more
Mm-hmm.
functional chain tests
Mm-hmm.
is intriguing. It's
It's a
it's interesting.
challenge.
Yeah.
It's a
And
challenge.
then I mean then of course you have to remember how to do the chain tests, what they actually mean,
And what
how to
you're
apply
going
the
to do to
correct
treat them.
what are you
Exactly.
gonna do to treat them? It's that's the best when I do the chain test and they fail it, and then I go, that's interesting. Let me check back with you on that one for the next visit.
That's right.
Oh, that's interesting. Posterior oblique chain. Oh, that's fine. Then we'll check
That's
back
fine.
next time. Yeah, don't
I'll make a note of that.
worry. Do a couple
Yeah.
more Mackenzie Cobras, and then we'll come back next time.
I'll have an answer for you.
Yeah.
Yes, it is the getting to the chain test. And one thing was interesting. I was teaching in Australia, and I had a patient who I was testing, and I thought he's cheating, but I don't know how he's cheating because I cannot find the weakness I'm expecting.
So he
And
was he was theoretically or strong. He was
he was
presenting as
strong.
strong.
Yeah, he was presenting as strong no matter what I did, especially when I was testing his hamstring. And uh, uh, lucky for me, I was like, well, I'm going to have to just go with what I'm finding. I have to realize that he is cheating me somehow, and I'll have to go with the faintest glimmer of inhibition.
Hmm.
But luckily, someone says, "Hey, he's arching his back," and it was so subtle that I go, "That's it. That's what he's doing." I was looking at him, wondering, "What is it he's doing?"
Yeah.
And it is so. One of the things I try now to do is when I do the hamstring test, I place my hand on the sacrum just lightly for the first test and make sure that I do not have an increase in lordosis as I do the hamstring muscle test. Because if you're a larger person, you can arch your back and it will be almost imperceptible. On someone who's thinner, and you can see it,
Yeah.
but
Yeah.
not easily so. So it is really necessary to know that when you do the hamstring test, it is purely the hamstring. There is no other synergistic um, uh, accompaniment to that.
I mean, what you're saying is true, obviously, but that is also part of the difficulty, the practical difficulty in doing this kind of thing because it's in one sense almost anything can kind of throw off a muscle test. If they're
Exactly.
thinking about their uncle who's in the hospital, they could throw off
Mm-hmm.
the muscle test, let alone slight arching in the back or
Mhm.
deviating.
Mhm.
It doesn't mean it can't be done. It just means that it's not as simple as, oh, boom, I'm going to do a muscle test. Oh, you
That's
passed, you
right.
failed. That's it. It
You
isn't there.
must,
There's an art to it, and there's
there's
a
an art to it.
experience.
And you must remember that the patient is subconsciously wanting to win. So he will move in such a way that he will has the maximum chance of beating you. And if you are not careful in minimizing those compensations, you will be the one who fails at being.
Now, what I mean, do you happen to remember, like you started this by saying like you knew something was up. He should have.
Yes,
I think you were saying like he should have been weakening, and he
yes,
wasn't. What was
yes.
the indication to you that this guy should be weakening here, and it's not?
The
You,
asymmetries that he had, the baseline findings indicated dysfunction. So he should show me some dysfunction at some stage.
okay. Yeah.
And even so, there was a disconnect between the picture presentation and then the assessment. It did not go together. And so
Right.
that was the telltale. And I was willing to work with it because it was a demonstration and I did not have much time. So I was like, well, you will have to rely on your sense of end feel. This is what is going to carry you through because it's not showing easily. And
Hmm.
to my frustration, it meant that the people who were watching me were like, we don't see anything. So
Yeah.
what are you treating? You know?
Yeah. What and why are
So,
you
yeah,
treating
why
this?
are you doing this?
He
Because
appears
we
very
can't
strong to
see
us.
anything. He appears strong. And so it was a difficult situation. But at once I had seen what he was doing, I was able to then understand why. And in fact, what happened was I gave up on him because he was unable to give me a pure hamstring test without arching his back. It was
Yeah.
not possible. So I just used arm abduction instead and
Right.
went on with it from there. But it was a good lesson. And
Hmm.
it was educating. And it was good because people could see it also and understand the science and the art of muscle testing and
Yeah.
where it could be challenging for somebody. Um,
Definitely. I mean, you said it, but it's, I mean, again, it's like, but the kind of patient that the person is on the table, if they're any kind of an athlete, whether, I mean,
mhm,
high school athlete or an older
mhm.
athlete, or they're, they work out, they're fit, those are the kind of people that want to win. They're not
Definitely.
used to going weak on you.
No.
So to like to weaken them is they're going to fight you every inch. So you
And
have to,
again, yeah.
yeah, I mean,
And
you have
again,
to be aware of all the little tricks and
that's right.
compensations that they can do in order to still win and beat you.
And again, I think that using the match my pressure command has been much more successful.
Mm,
You know, push against me or don't let me move you can end up being a battle of wills. And you rarely have to use your fine sense of give in some cases because the patient then thinks this is a battle royal that
right.
and again you do not want to instruct to the point where you start affecting their ability to produce force.
Yeah.
So
Yeah.
you can't say don't push so hard. What does that mean?
Yeah. Yeah.
You're polluting the test by telling somebody that. So match my strength or match my pressure is really a very good thing. And again, a shout out to um, Dr. Um,
Ryan.
now Ryan
Yeah.
Ham, yes, for bringing that information in when we last met and really expanding the possibilities of of testing better, especially when you first start, because you
Oh
need
yeah.
to find a way to really moderate the strength testing, but keep it pure and keep it unadulterated by too much instruction.
If you
So
enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.